English translation 552nd contact Sunday, the 3rd of February 2013, 032 hours.
Hello, Ta. There you are, dear friend. Welcome and greetings. Although I expected you later, not until noon tomorrow, I understood you during our correction work yesterday.
Greetings also, dear friend. I did not name a time, I only said that I would come today. And since you are always in your workroom until the early hours of the morning and work, I thought that I could also come here now. You are working on the book on depression, I see.
Of course, as usual. It is my need to have the book ready by the 9th of February. I started it on the 9th of November 2012, so it took me 3 months to get it together. I want to thank you again for your father's faith and your explanations. Without them, I would have stood like a donkey on a mountain.
My father and my explanations are to be considered only as such, but you have taken on the great work of the explanations. I have studied and taken note of all the copies of what you have written so far, and I have to say that your art of execution, explanation, and writing is, as usual, unsurpassable. My father's and my explanations are small compared to your new achievement, which, moreover, you have achieved in such a short time.
You are too kind, Ta. I am only doing my duty.
Which you have imposed upon yourself, and which will surely benefit many Earth humans.
Never mind. Before the correction, I asked you briefly if you could give me some information about Lyme disease during this current visit, which you said yes to. It would be important for me, because 3 days ago at night I had a phone call from a young man, he is 23 years old, who complained to me about his suffering. And according to what he told me, I guess that he suffers from Lyme disease. So it would be important for me if I could find out some more about it, which I would like to fax to him. So if you can tell me some more, of course as usual related to the earthly conditions, I would be grateful.
I would be happy to do so, because on the one hand I will not get into conflict with our directives, and on the other hand I will also combine my explanations with Earth humans' knowledge, which I will bring into my explanations. With regard to the disease Lyme disease, there are, in my opinion, also important factors to be mentioned which Earth humans are not yet fully familiar with. So I also have the following to say in this respect. Mainly ticks, but also insects such as horseflies, spiders, and mosquitoes, etc., transmit Lyme disease. Unfortunately, the conventional medicine on Earth does not offer a long-term helpful Lyme disease therapy. Prevention and effective tick control also seem to be hardly possible from the point of view of conventional medicine. So far, only ticks are considered to be the carriers of Lyme disease. But spiders and all kinds of other insects are also responsible for Lyme disease, which is more dangerous than many other epidemics, which is unfortunately unknown to the population. Lyme disease affects tens of thousands of people every year, who are newly infected by ticks and other insects, although the exact number is probably unknown, because in many people the symptoms of Lyme disease are not associated with the disease at all. It therefore often takes many years before Lyme disease is diagnosed, even their 10, 15, or 20 years. The human beings affected by this disease are often not taken seriously at all and are often only treated as malingers. Once the diagnosis has been made, however, it turns out that orthodox medicine is not very competent in terms of a helpful Lyme disease therapy, especially when it is recognized that the disease is already in a chronic stage. As a result, high-dose antibiotic therapies are then given for weeks, which are the only conventional medical answer to Lyme disease. It is not uncommon for such treatments to remain ineffective, although in contrast, side effects are very common. A tick repellent can only be achieved to a very limited extent with chemical means, just as little with most natural insect repellents. Reliable protection against this is offered by natural organic coconut oil, completely free of side effects in both the human being and animal. Ticks can be successfully banished with coconut oil. If Lyme disease is already present, more can often be achieved with alternative therapies than with antibiotic cures rich in side effects. Tick clothing, respectively, wrapping yourself in clothes, etc., does not protect you at all. And anyone who has already had experience with ticks knows that they are not deterred by clothing and will quickly find every crack through which they can get onto the skin. Ticks live in woods and meadows, but it is no use at all to move around indoors and on the streets because there are many more health risks than in the wild. Lack of exercise, weight gain, and vitamin D deficiency due to a chronic lack of sunlight. However, what is not yet understood by today's medical experts is the fact that not only ticks transmit Lyme disease, but also mosquitoes, horseflies, and various other stinging and blood-sucking insects. Thus, various tiny spiders and other insect creatures can also be involved in the spread of Borrelia bacteria. So the prevention of borreliosis is not only about ticks, but also about some insects, which the human body should be made as unattractive as possible with repellents. Borreliosis, also known as Lyme disease, is officially described as a multisystemic infectious disease caused by Borrelia, a type of bacteria from the group of so-called spirochetes, which can often result in a long list of the most varied symptoms. This is the case because the causative Borrelia bacteria e.g., Borrelia burgdorferi or also Borrelia afzeli, are extremely mobile and wander cheerfully through the whole body of the human being affected. They damage tissue and organs indiscriminately and also leave behind toxic excretions which can act as a dangerous nerve poison, causing body tremors and other nervous disorders. Unlike most other bacteria, spirochetes do not have correct cell walls. However, as most antibiotics work by destroying the bacterial cell walls, antibiotics have a very unsatisfactory or even no effect on Lyme disease. Lyme disease symptoms also have an endless variety, with the so-called wandering blush occurring in the initial stages. This is a red circular area which, if the tick or other insect in question was infected with the borreliosis pathogen, appears around the problematic tick or insect bite respectively. There are, however, many human beings affected by Lyme disease who are not affected by a wandering reddish color respectively by a round red skin appearance, and who are also not able to remember a tick or other insect bite, although Lyme disease can still be present. Either the reddening of the skin is overlooked in such cases, or does not occur at all. It is also possible that the cause of the Lyme disease is not transmitted by a tick, but by a mosquito or other biting insect. Symptoms of Lyme disease include joint inflammation and back pain, and because Lyme disease also occurs intermittently, possible symptoms that cannot be reliably determined also appear, as they do not appear at certain times, but rather sporadically and in different forms and combinations. Flu-like symptoms, dizziness, joint swelling, joint and muscle pain, or gastrointestinal complaints appear particularly at the beginning. Later, almost all conceivable symptoms can occur, from chronic fatigue, concentration, and sleep disorders to mental, emotional, psychological changes. In the so-called chronic third stage, inconveniences such as paralysis and, in addition to the above-mentioned joint inflammation and back problems, also heart problems, inexplicable states of depression and mood swings, and much more can occur. There is a risk of confusion with other diseases, according to which all these clinical pictures can easily be confused with old-fashioned diseases such as arthrosis, arthritis, slipped discs, bursitis, tendinosynovitis, and many others. Usually these complaints are then treated with chemical drugs, but these only further damage or at least weaken the immune system and the self-healing power of the organism, which in turn promotes the spread of Borrelia bacteria, which further aggravates the complaints and the disease. Often the Lyme disease symptoms are misdiagnosed. For example, when paralysis symptoms occur, which are then not infrequently diagnosed as poliomyelitis infantile paralysis in relation to allegedly clear test results. Polio is a viral disease and by and large is considered incurable. Borreliosis, on the other hand, is a bacterial infection that could be eliminated with the correct means, at least in the initial stages, as it can be treated with antibiotics and dissolved. Although Lyme disease can in some cases be successfully suppressed with a short-term application of antibiotics in a very early stage of the disease, in a later stage of the disease, this is only rarely possible without the simultaneous support of the immune system. It is also important to note that if Lyme disease appears, it can also be detected in the blood for the rest of one's life after a cure because the signs of Lyme disease, which are similar to those of syphilis, persist in the blood count. If a wrong diagnosis is made for Lyme disease, this can make the human being a permanent patient, with no hope of improvement, although there are definitely cures if only the correct diagnosis is made, as is also the case with many other diseases. Unfortunately, it is a fact that many human beings who suffer from Lyme disease, which manifests itself differently in different human beings, are accused by a larger number of inexperienced doctors of being hypochondriacs and malingers. This happens in many cases, as is also the case with the human beings who have psychosomatic problems and chronic fatigue syndrome. The currently used antibody tests for Lyme disease are often extremely ineffective, because after a tick or other insect bite, the so-called IgM antibodies are formed after 2 months at the earliest, so they cannot be detected immediately after a bite. This is exactly the time when such a test is often carried out. In the late phase, these antibodies may no longer be present at all. IgM antibodies are only formed later and are usually detectable for life. Depending on the state of the human being's immune system, antibodies can also sometimes not be detected later, despite infection. Effective prevention is considered the most important health care with regard to Lyme disease. There is no infection from human being to human being, e.g., at birth or during sexual activities, which is why only the tick or other biting insects are the actual carriers. Without a tick or insect bite, there is no Borrelia, and without Borrelia, there is no Lyme disease. Many chemical but also natural insect repellents are useful against mosquitoes, but not against ticks. And even if ticks keep themselves away from an attack for a short time after the application of the corresponding repellent, the effect of the repellent decreases very quickly, so that chemical repellents have to be rubbed in again respectively applied to the skin every 1 to 2 hours. This is in contrast to coconut oil, respectively, its active ingredient lauric acid, which is effective for up to 6 hours. Natural coconut oil is therefore a useful defense. The repellent effect of coconut oil is effectively based on the so-called lauric acid, a special fatty acid. If coconut oil is left in its natural state, it contains up to 60% lauric acid. This belongs to the saturated fatty acids, the so-called MCT medium-chain triglycerides. Lauric acid is very effective against bacteria, yeasts, fungi, as well as against certain viruses, whose envelope membrane it dissolves and the viruses are quickly inactivated. Lauric acid also acts quickly and effectively against herpes, measles, and other viral infections. Coconut oil contains a higher content of effective lauric acid the less processed and the more natural it is. The use of coconut oil, usually in the form of coconut fat, in the human being is very simple, because it is simply applied to the body, just like any skin cream or body oil. This is solid, but it liquefies immediately when taken in the warm palm of the hand, after which it can be easily applied to the skin. It also has a pleasant scent and feels soft on the skin, but it also disinfects, nourishes, and protects the skin. Coconut oil is also suitable as a high-quality and natural body care product. There are also alternative known therapies for Lyme disease on Earth, such as 1. Reduction of harmful substances in the body of Borrelia metabolic products with the help of intestinal cleansing, for example with bentonite and psyllium husk powder. Taking bentonite 3 times a day ensures immediate absorption of excess acids and harmful substances. The positive influence of bentonite is supported by the detoxifying effect of chlorella algae. 2. Deacidification of the body, whereby base powder is a valuable product. 3. Drink 1-2 liters of still water daily, low in carbon dioxide and minerals. 4. Alkaline raw food stress diet made of fresh ingredients, whereby especially gluten-containing foods and dairy products should be avoided. 5. Magnesium supply with transdermal magnesium chloride. Borrelia consume magnesium. As a result, the body lacks it and suffers from magnesium deficiency. This happens especially when magnesium is taken orally. Borrelia bacteria have no access to transdermal magnesium chloride. Transdermal magnesium chloride is sprayed on the skin, however. So far, I can make my explanations, which are also mixed with earthly knowledge and insights, which should actually be enough. As far as you do not have separate questions, I may have to answer them privately.
Thanks. That should be enough, because the whole thing does not have to correspond to a medical treatment.
Then I would like to surprise you now, but what is spoken is supposed to be purely private and not to be recorded as a conversation report.
As you wish. Then let us hear what surprise you have in store.
I have to kidnap you, so to speak.
Eh?
You will be taken by me to my big space flying apparatus.
This is indeed a surprise. Thanks, Pa. This is really a great pleasure for me. But why did I bring you into your...
A second surprise will await you there.
You do not want to give it away, do you?
You have seen that correctly. But now we have to.
Supplement to the surprise. The surprise was really big. Because in Ptah's Great Spacer, I was welcomed by his daughters Simyase and Plagia, as well as by Ikarina, Asket, Nera, Quetzal, Taljda, Manara, Danel, Zafanat Paniach, Electra, Zeruala, and Zeruela.